Hey, what's going on, everybody? It's your girl Darshawn. I'm back with you guys. Remember, I'm a licensed marriage and family therapist, and I'm a professor here in Los Angeles. Let's say you've gotten past all the myths, the stigma, which is the purpose of this again, to kind of break down the stigma about mental health and going to see a therapist. Let's say you decided, you know what, actually I do need this. I need this extra support. Something is, causing an obstacle for me. I can't grow, I can't develop. Or maybe I have some trauma in my past that keeps coming up. It keeps triggering me in my relationships with people. So yes, I'm going to seek a therapist, right? So that's not where you stop. So you have to start looking for a therapist that's going to be a good fit for you, because with anything, it's a healthy therapeutic relationship you want to kind of establish with your therapist, so they know you, you know them, and they know exactly where you're trying to go. So there are some things that can cause a disruption in finding a therapist that will be a good fit for you, right? You want to take into consideration, what type of therapist are they? So obviously I'm a licensed marriage and family therapist. There's a board that governs me. There are certain things that as a licensed marriage and family therapist I focus on. Relationships, the quality of your relationships, how things you've been through and are currently going through impact the nature of your relationships and your access to a healthy quality of life. There are social workers, there are licensed professional clinical counselors. There are so many different types, and everybody's education process is different. So you want to take that into consideration. Some people say, oh, I want a real, old school therapist or experienced one that's been doing this a long time. Sometimes getting a therapist that is more experienced, yes, they're going to have the knowledge, yes, they're going to have the experience. You have to be mindful still about the fit, because a therapist that's been doing this longer may have experienced burnout, may have experienced compassion fatigue. So their zest and zeal to help you and push you along towards the goal that you have for yourself may not be what you need. Also, what are your levels of comfort with culture? And when we talk about culture, we don't just mean your race, your ethnicity, but also what are your religious beliefs and spiritual practices, right? What's your family culture? What's your culture of origin in terms of how you grew up, how you interact with people? That's really important. Now, as a Black person, it's really hard, right? And other persons of color and indigenous, when you have a therapist that does not understand the culture you come from. Now, that's not to say a therapist that is not from your particular culture can't help you. That's not what I'm saying at all. What I'm saying is you will have to be mindful of the work you'll need to do to ensure that you're comfortable with the fact that they don't come from the same culture that you come from. The space that you're in a therapeutic alliance should be safe. You should feel like there's trust, and there should be some kind of connection there to help you be comfortable enough to be vulnerable. Because again, you're going to be coming with some of the most difficult topics that you're dealing with in your life. Maybe past trauma, childhood difficulties, relationship difficulties. And those are not things that you want to share with somebody that you don't feel connected with. Hey y'all, if you liked whatever you heard today, if you are interested in it or wanted more information, please make sure you click like and subscribe.